Good afternoon, and thank you for joining us for our January 21st, 2022 COVID-19 pandemic update. My name is Mark Schulmeyer, Fire Chief for Brevard County Fire Rescue, filling in for Don Walker today. Our guests joining us today are Maria Stahl and John Davis from the Department of Health. We have John Scott, the Director of Emergency Management. We have Ian Golden, the Housing and Human Services Director, and Catherine Allen with the School Board. And as always, we have Jesse Ray, Brevard County Social Media Specialist, who will be monitoring the program today for any questions the media and our viewing audience may have. So with that said, we will turn it over to John Davis with the Department of Health for the weekly update.
Okay, thanks, Mark. So we look to be trending in the right direction. I believe we're looking at a slight decrease in the weekly case count. However, I do want to point out that while that's a good thing, we're still at record number of cases. So we're looking at well over 1,000 per 100,000. And to put that in perspective, before this latest surge, in late November, we had gotten as low as 37 cases per 100,000, to just give that some perspective. So while it's starting to look like we've reached that peak and are starting to decline, we're still at record levels. So I do want to emphasize that. Our hospitals are starting to see an increase in some of their ICU admits. Again, the vast majority of people that have this are having mild symptoms and doing okay. But it's simply a numbers game. We have so many cases in the community that then is impacting the hospitals. And we have to understand that while we might be starting on a downward trend, the fallout in our healthcare system is typically 2 weeks later. So when you get a positive case and then that person then becomes symptomatic, and then a few days out from there, they might require hospitalization. So even as we're getting better, I think the hospitals are going to continue to feel the strain, for the next few weeks here. And certainly their own staffing issues play into that. Just like anywhere else in the community, plenty of people have this and are out from work, and that's certainly a big strain on all the hospitals across our system. We're seeing the same thing in the long-term care facilities. As time goes on, more and more facilities are experiencing outbreaks, and certainly they have a reduction in staff as well. And a lot of our resources are of course, focusing on that high-risk congregate setting. With our limited resources, we really have to focus on those folks most at risk for hospitalization and death, and that is our elderly population. Schools certainly are a reflection of our community in general, so certainly seeing increases in cases there. Again, I'm hoping that decreases here soon, since we are seeing a little bit less in terms of our daily case rate the last few days. Vaccinations essentially remain static. Slight increase in preteens. 17% of the population of preteens in this county is now vaccinated, or at least has one vaccine. That's up 1 percentage point from last week. Our teens are at 50%. That's no change from last week. And overall, our vaccine eligible population for the county as a whole is 69%. And again, that's the same as the week prior. Most of the vaccination traffic we see at this point is for boosters. So where does that leave us? Again, the message continues to be the same, that we highly stress vaccination for those that haven't been vaccinated. Social distancing, masking in public indoor settings. If you're sick, please stay home. Self-monitor. These are things that we know work, and we continue to encourage the community to utilize those measures. And again, we do have plenty of testing capacity here throughout the county, as well as vaccines available. You can go to brevard.floridahealth.gov. You can go to 211.brevard.org, and certainly the county website at floridafl.gov, and find the information on the sites that are available for testing and vaccination. Mark?
Thank you, John. Next up is John Scott, Director of Brevard County Emergency Management.
Good afternoon, everyone, and thanks, Chief. My name is John Scott. I am the Emergency Management Director for Brevard County. Just want to hit a couple of points and really build off of what John said. while we are encouraged that we're starting to see some downward trends, we continue to need to stay vigilant as we go forward. On the testing side of the house, it continues to be widely available, both at the sites that we partnered with along with the Department of Health, commercially in urgent care centers, in doctor's offices, at pharmacies. All of it continues to be widely available for folks who are looking for it. I will also note that we are starting to see a slight decline in the overall demand for testing. That probably is reflected in some of the numbers we're seeing elsewhere. Again, encouraging news, but still very early in that trend to take a deep breath. Last week, the President's program to provide free at-home testing to everyone went live. That graphic's there on the screen for everyone. Again, that's covidtests.plural.gov. Each residence gets 4 tests. You sign up. It's fairly simple to sign up. They're mailed to your residence through the post office. I believe they expect to start shipping all those kits out later this month. So that's encouraging as we continue to find new ways to get testing out to folks. I'll talk briefly about the monoclonal antibody site, which is in Rockledge. Continues to remain operational 7 days a week. Continue, due to the short supply nationwide on that monoclonal, continues to be limited to those that are COVID positive, and you want to bring proof of your COVID positive test, and that you have an appointment. We know appointments continue to be a source of frustration for folks. They go very quickly. We ask, continue to be patient. Go to the patient portal FL site that was just on your screen. Sign up, register, and continue to monitor for appointments as they become available. And again, we know, every time we're here in these meetings, we talk about those good common sense measures that, beyond treatments, beyond vaccines, all those things which help us day to day. As we start to see some trends on the downward side, again, I want to emphasize, now is not the time to relax. Now is the time that we continue to stay vigilant. We do those good common sense measures, and we do everything we can to slow the spread as fast as we can. Chief?
Thank you, John. Now we get an update from Ian Golden with Brevard County's Housing and Human Services.
Afternoon. Thanks, Chief. Just some quick updates regarding our rental assistance program. To date, we've received just under 2,700 applications. That's both initial applications or first-time applications as well as repeats. Of those, 98.5% have gone through a processing. About 12, almost 13% of them are actually awaiting, and this is the biggest delay that we're seeing right now, responses back from the applicant. They tend to have a lot of missing documentation, and so when we reach out, they either don't respond to us or don't provide the information, and so their applications take longer than usual. We're averaging probably just about $5,300 per household. And I will emphasize that we have about $8.4 million remaining in the rental assistance funds. So I would encourage anybody who has had any type of financial impact from COVID in 2020 to apply. If you have had a loss of a job, but you've now gotten employment, you still could be eligible for assistance because that financial impact you're not going to make up from 2020. So there are these funds available, not only for what you might owe, but also for perspective. So if you are eligible, we are able to pay for, in 3-month blocks, future rental assistance. And so that can be of tremendous benefit as families are trying to cope with if they have some medical issues, medical bills. And again, loss of employment, loss of income. So again, we encourage anybody to apply. We have, that you can contact us through email, through online. We have multiple telephone numbers available at the website. The application is available, all 17 libraries, on the county website as a download and also as a direct link on our website where you can access an entire application online, including submitting it online. Thanks, Chief.
Thanks, Ian. And last but not least, we have a update from the Brevard County School Board, Catherine Allen. Thank you.
Thanks, Chief. We did have a change to the district's COVID-19 reporting procedures that began on January 18th. So the school district and the local Department of Health will stop contact tracing will stop contact tracing for the reported COVID-19 cases in our school. What this means is that you're going to notice that quarantines no longer appear on our dashboard, and that change actually took place today. So again, they're not going to be tracked or appear on our dashboard, and there are a couple reasons for this. One thing before I move on, make sure that you're still reporting. If your child is positive with COVID, please still report it to the school so we can go ahead and make notifications in the classroom. So two main reasons for this change. The first being that the state of Florida has transitioned into a new phase of battling this pandemic. Here in year 3, they just recently outlined some new priorities that are focused on preventing the spread at long-term care facilities. And secondly, per state rule, parents are not required to quarantine their children, even if they are a contact to a COVID case, unless they are symptomatic. We have seen parents overwhelmingly send their students to school, even though they were notified that they were a close contact. So because of that, the quarantine numbers that we were delivering on our dashboard really weren't able to be presented as accurately as what we would want, since the number of students being identified as close contacts didn't correlate to how many of those students were still being in their classes every day, still attending regularly. So if you have any questions on that, you can certainly reach out to us. Again, we will still be posting our dashboard every Tuesday and every Friday at brevardschools.org/COVID-19. Again, you just won't see quarantine information anymore. There will still be notification if your child has a possible contact. If there is a reported positive in your child's class, then you will still receive notification that they were possibly exposed. One thing to keep in mind for those students who do switch classes, you may receive multiple emails or notifications. That doesn't mean that it's all different individuals. If Joe has 3 classes with Susie, you're going to get those 3 notifications because Joe is in 3 classes with Susie. So it's not a perfect system, but it's definitely where we're at. And we are happy to answer any questions that you have.
Thank you, Catherine. And so now we're to the point of our program. We'll return it over to Jesse Ray to pull up any questions that have been asked by our followers and the media. Jesse?
Thanks, Chief. So I'll start with the media questions, as usual. Do we know how many individuals are hospitalized for COVID-19 countywide?
I don't have the exact number of those hospitalized from day to day. We know that it is less than we saw during the Delta surge. And again, as I pointed out, there has been an increase in ICU admits, but I do not have the overall numbers for today.
Okay. Do we know why or if there have been more vaccinated individuals hospitalized during the Omicron variant surge than the other surges that we've seen?
So certainly the hospitals on the hospital call, they are indicating that the vast majority continue to be unvaccinated. Having said that, we certainly know with this Omicron that those that are fully vaccinated are getting the infection. However, they're less likely to be hospitalized, but we are seeing it in small numbers.
Okay, thank you. After the Omicron surge, can residents expect another variant? And how do vaccinations protect against Omicron and other potential variants?
Well, again, as I think the numbers show, that it's pretty clear that with Omicron, the vaccines are less effective than they were with earlier variants. However, I think the bigger message is that it still makes it less likely that one becomes hospitalized or certainly dies from an infection. Moving forward, I don't want to make any predictions. I mean, like everybody else, I hope this is it, but I'm sure the virus will continue to evolve, and in terms of what a vaccination looks like in the future, I really can't speak to that. I mean, I assume that at some point the formulation of the vaccine may change to match what ends up being maybe the underlying variant for the long term, but I don't know.
Okay, thank you. How much of an issue is staffing at local hospitals right now? Are any staff members out because of COVID-19 issues, and how is that impacting patient care?
Well, certainly all our hospitals have reported that they are having staffing issues related to COVID. Again, it's no different from anywhere else in the community. I mean, I think any employer of any size has been impacted by this, and certainly the healthcare industry as well. How it impacts patient care, I really don't want to speak to that. I mean, each hospital has its own contingency plans and moves staff around. So I don't want to speak to how it may impact care, other than, I mean, we do get word if there's certain procedures that are put on hold that aren't life-threatening. Elective procedures at times have been delayed. But in terms of the care of inpatient hospitalization, I would assume they do what they can to provide that same level of care as they always do.
Sure. Are people able to get Paxlovid here in the county? And if so, where can they find that?
I'll take that one. So that's the Pfizer antiviral. It's the same, and a company called Merck also has a antiviral that's been approved. Right now, we're not aware of any of that in the county, and I should point out that there's not a lot of that in the state right now. Limited quantities are being provided nationally. They're still ramping up production. However, if you do go to the Department of Health's website, they have what's called a treatments locator. So just Google Department of Health COVID treatment locator. It'll come up and it'll get you to some sites that are, that do have it across the state. I would tell you, we happened to be looking and researching this issue yesterday. There were not a lot of them within driving distance.
Okay. Ms. Allen, is it an excused absence if a child comes in close contact with someone and the parents do choose to keep their child home from school?
Yes.
Yeah, okay. And last one for today. Chief, how are the calls looking for your staff as far as the IS calls go for COVID? Have those ramped down at all?
So they remained steady. They ramped up right at the beginning of Omicron. They were nowhere near what we saw with the Delta variant and with the initial COVID-19. So they remained steady at about 10 to 12 per day. If you remember back in 2020, we were running about 30 or 35 a day. So pretty steady. So far, the patients that we have run on, very mild symptoms and not like it was last year.
Okay. And that's all that we have for today.
So, thank you for taking time out of your busy day to tune in. Our next COVID-19 update, I believe, is Friday, January 28th at the normal time of 11:30. And so thank you for joining us, and we'll see you later.